We now want to bring in our health reporter Haley Hernandez with new information about quarantine guidelines.
The CDC coming out with a new recommendation, Haley.
Yeah, this broke earlier this afternoon. The isolation for people with COVID is once again a little shorter, now less than half of what it was at the beginning of the pandemic. Only 5 days for people who do not have symptoms. The CDC says this decision was made as they learn more about Omicron. Useful information for all of you, since Houston doctors expect the cases to rise.
According to the Texas Medical Center, last week was the largest weekly average of daily new cases on record, with 5,053 per day. This surpasses the Delta spike and previous holiday spike. Doctors anticipate after the Christmas gatherings, more people will begin testing positive any day now, particularly with the Omicron variant. But that's no reason to panic.
I wouldn't go to the emergency room unless you're short of breath, because you don't want to clog up the emergency rooms. Our emergency rooms are already exceptionally busy.
Dr. Septimus says if you're in bad health, notify your doctor, but wait to go to the ER only if you're experiencing bad symptoms like shortness of breath. If you do experience something like that, you may need treatment within a few days. New treatments include antiviral pills by Merck and Pfizer. The good news is Pfizer is tremendously effective. The bad news is Texas has not received any yet. The federal government hasn't allocated any to our area, but that is expected to change soon.
But ideally speaking, at some point when we have supply, anybody who comes in with COVID would be given a 5-day prescription of these pills. And what they do is they decrease the chances of progression to severe illness, hospitalization, and death.
And monoclonal antibodies, the outpatient treatment that was working great against previous variants, is down to only one brand that can fight Omicron. And today, the Department of State Health Services confirms they've used them all up. They say to expect more in January.
And again, the CDC says if you do test positive, you only need to isolate for 5 days if you are asymptomatic. And it's important to wear a mask the remaining 5 days, and of course, notify other people that you might have exposed. While many doctors do encourage you to take over-the-counter supplements to boost your immune system with all of those mild infections, Dr. Septimus said that the only one he thinks is really worth taking is vitamin D. And if that does interest you, he recommends no more than 2,000 IUs. Guys, back to you.